Hi everybody. I am so glad I get to talk to you today after our big wonderful filling together. I wanted to just take 5 minutes of your time to let you know what to expect because not everyone comes in and has huge fillings done all the time. There are a few things that you need to know, a few things to just recognize if you need to call us, so let's get started. First off, I absolutely expect the tooth to be sensitive. We went in there, we drilled around, we beat it up, we put filling in there. It should be sensitive. So what does this mean? Anything hot or cold, it should give it a little bit of an oh hello feeling, okay? This does not mean that it should linger. This does not mean that it should throb. This does not mean that it should randomly hurt. There should always be a reason for it bothering you, and you should know what that reason is, and it should go away very quickly. If it lingers, there's other issues going on, please call us as soon as you can. This is an indicator that there's something else going on that we need to look into. Secondly, we had you open like a crocodile to do the filling, right? So that means that you were open wide. It also means that there's a 99% chance you were numb when we did it, so your bite could be off. This is something that happens sometimes. We do the best we can with the bite paper to try to get as close as possible, but things happen. So what does this mean? If your bite feels off, it feels like your teeth aren't coming together properly, it feels like there's a pebble in your tooth, you're getting jaw pain, something's not right, the filling is not going to wear in, you do not need to get used to it, that is not normal. So give us a call. Fixing it takes 5 minutes or less and it will make your life so much better, okay? The filling itself should be smooth. It should be smooth to the tongue and you shouldn't have any issues with it or even notice that it's there. So if that's a problem, it takes 5 minutes to fix, please call us. You should be able to floss like normal. You should be able to put the floss down and pull the floss out without it feeling like you're gonna rip the filling out, without the filling and the floss itself shredding. None of that stuff should happen, okay? So if that's happening, please call us. That means that we need to adjust something for you to make your life better. You should be able to brush the filling like normal as soon as you leave. There should be no problems with it, so do not hesitate to treat it like a normal tooth. If you don't, then you could get some gum inflammation, and we don't want that, bleeding, all that stuff. That's no good, okay? You should not be able to get any food caught in between the areas where we had the filling done. If there's food getting caught, that means that you are at high risk of having a cavity in that area in the future. No bueno. So please call me as soon as you can and we'll get that fixed as fast as we can. And last but not least, for most people who have large fillings done, the biggest problem is that they've had Novocaine. And Novocaine can be painful. Not when it's done, well, there's a little pinch, of course, but the area where you had the Novocaine at the end can be a little bit sensitive because it was placed there. This is 100% normal, and most people have these issues, okay? What do I mean by this? If you have that problem, feel free, take a Tylenol, ibuprofen, something that you need for a couple of days, it should go away. If the issue lingers and you're having problems, please call me. This is not normal and something that needs to be addressed. So I hope everyone has a great rest of your day. Enjoy it and enjoy your new filling. We'll see you soon.